Dr. Fraser, you often talk about proactive imaging. Can you tell us what that means?
Yes, I think this is part of medicine 3.0, is that you need to take a look and see what actually is going on inside your body before symptoms occur. A lot of patients are falsely reassured by lab tests and other indirect tests that actually don't demonstrate as to whether you have disease or not. So using CT and MRI, we take a look at the number 1, 2, and 3 cause of death and disability in most individuals and make sure that if you do have those types of issues going on, we discover them and then we can treat them. And also, if you don't have them, we can end up being reassured and appropriately reassured based on facts.
Why do you think imaging is so important if someone feels healthy?
Well, feeling healthy is sometimes a fairly common thing in patients that I see in the ER who are presenting with a heart attack, with a new diagnosis of cancer or a stroke. And the day before, they felt fine. These things were all discoverable long in advance. So I don't think that feeling healthy necessarily is the best longevity strategy. Heart disease alone kills over 900,000 Americans each year. And 70% of those patients that have heart attacks are individuals that would be considered to be low risk. And most cancers, about 70% of them, don't have a standard screening test available. And these types of imaging that we recommend end up filling in those gaps.
What kinds of problems can imaging actually find early?
Things such as vascular disease in your brain, in your heart, aneurysms, tumors. Have you had a stroke already? Don't know about it. Those are kind of the main things that we would be looking at with imaging.
So what scans do you usually recommend for your longevity patients?
So we really like Simon 1. Some centers, it's called Simon Med. They have a really decent whole-body MRI plus that ends up covering so much. It scans over 100 potential areas and issues. They use a 3 Tesla magnet, which gives very high resolution. There's no radiation involved. And they take a look inside your blood vessels in your brain so that they can tell, have you got any buildup of plaque? Take a look at everything through your chest, abdomen, pelvis. So do a specific protocol for men on their prostate, women on their ovaries and uterus. So it's a really good scan, and it's cost effective for what it is that's being offered. Additionally, we take a look at doing a CT coronary angiogram, typically with clearly analysis, to take a look and see if you have vascular disease in your heart and how high risk it is, which will allow us to be certain on how we would recommend treatment should occur if you have disease.
Let's start with the whole-body MRI plus. What does that include?
Yeah, so the whole-body MRI plus is a scan that includes an MRA, head and neck, and it includes something called NeuroQuant, which is a tool that ends up taking a look at each segment of your brain and telling you where you're at by percentile compared to others your age, and also can track areas that are particularly high risk if you're going to end up developing dementia, such as your hippocampus or your caudate nucleus, and you can see if those are shrinking over time. They also have a way to tell as to whether your hippocampus has shrunk compared to what it was previously on something called a hippocampal occupancy index. So there's a lot of detail that you get to learn. Also, it's going to look and see, do you have any shrinkage of your brain, or what's medically called atrophy? Do you have any white matter changes, which are basically small vessel disease, oftentimes due to things such as cholesterol, blood pressure, insulin sensitivity, omega-3 index, vitamin D, for example. So there's a lot of detail that you're going to get out of the whole-body MRI plus just on the head and neck. And then the rest of it is going to be a look at your chest, abdomen, pelvis, down to a resolution of about 1 millimeter, where they're going to take a look at everything and see if there are any abnormalities. And if there are, then we need to interpret those and decide what needs to be done, if anything. A lot of things just need to be followed over time, make sure that they're not changing and they're old changes that are harmless. But sometimes we find things that are serious.
And what about the heart scan, the CT coronary angiogram with clearly analysis?
I think this is a little bit of a game changer over just a CT coronary angiogram. This is something where we get to determine as to the risk and type of plaque that is inside arteries when you have this. Because there's some types of plaque, like calcified plaque, that are fairly low risk to cause an event. And then there is low density non-calcified plaque, which is very high risk of having plaque rupture and having an event, even if it is a small amount of plaque. And then there is just the non-calcified plaque, which is at moderate risk. So we can get an idea as to how much of that you have, how much of that is up against your vessel walls. And that is something where that can allow us to have some sense of what your risk is of having an event and how aggressive we should be with the therapy, if any is needed.
How do you recommend people schedule or space these scans out?
Yes, it is a little bit of a wallet biopsy with these scans when you start out, because initially we want you to have the full scan, and the combination of whole-body MRI plus a CT coronary angiogram clearly ends up being about $2,820. So that's a fair bit upfront, but you get a lot of information and we get a really good baseline. Years 2 and 3, for most people, we're just going to do the full body MRI, which takes a look head through pelvis, and that's just $650. And then on year 4, typically repeat the whole body MRI plus, and then years 5 and 6, just the full body MRI at $650. And it ends up averaging out about $1,100 a year. Unless you live in New York City or Northern California, it is a little more expensive there. And this is anticipated costs if your scans don't have any major abnormalities. If they have major abnormalities, then we're going to probably want to do them more often. And it is something where you can use things like HSA and FSA funds to pay for these studies.
Is it difficult to schedule these scans?
No, it's not. Generally, what we do is we end up faxing a request to Simon One for the CT coronary angiogram, and they will contact you and set up a time. And at the same time when they call you, if you're going to be doing an MRI, which most time you would be, then you just let them know that you'd like to add that, and they will end up scheduling that for you at the same time. So you can get it all done at the same time. It's important to note that the MRI does not require a doctor's order. It's their only test that does not require a doctor's order. Sometimes their schedulers are a little bit confused about this, and it is important to remind them that if they go that you need a doctor's order for it, to just remind them that they need to talk to a supervisor and that this is their one scan that does not require that. So very easy to schedule, easy to get it all done at the same time. So I think if you have any problems, we also have a concierge scheduler who we can have you contact if there are any issues with the scheduling.
Some people worry these tests might be expensive or cause unnecessary worry. What do you say to that?
That's a valid concern, but I think that overall that knowledge is power, and it's an issue of having that knowledge filtered by somebody like myself so that we take a look at what the data is and sort out what is sensible. Overall, yeah, there's a little bit of expense, but exactly what do you put the price of a year of additional quality of life being? Or if you have a cancer, getting it discovered based on symptoms 5 years from now when it could have been discovered now in a stage 4 disease rather than stage 1 disease, where now your likelihood of a cure ends up being very low, where initially it would have been almost 100% and with minimal effort and pain. So I think that it is a value proposition with this, is to avoid getting symptomatic disease. It doesn't matter if you have disease, it matters if it becomes symptomatic, whether it be vascular disease, whether it be a cancer. I mean, there's a lot of prostate cancers that we're just going to monitor, where they're never going to actually be the thing that limits your length of life. So there's a lot of decision-making that needs to go into interpreting these studies and recommending what to do about them. But in general, I think that the cost is manageable for most people, and there's a big value proposition on doing this.
Bottom line, who should consider these scans?
I think anybody who is interested in making sure that they have quality and length of life possible, especially over age 40. It's part of the longevity strategy. Identify things early when they are easily addressed. A general principle is that disease, once is established, is very difficult to reverse, and catching things before it becomes symptomatic and at an early stage gives us much more opportunity to make a difference and also potentially save your life and your quality of life. So I think these tests should be broadly ordered. I think that people should get these. And the other thing to mention is much insurance won't cover the cost of these studies. Once you find something abnormal on this, they are stuck with needing to work it up and do things that need to be done. So it is something where, yes, there's a cost out of pocket, but it is something where if there's an issue, it is something where it would be covered under your insurance in almost all circumstances.